international representative of Germany, Freedom and Home, the professor of Berlin University Charité Clinic. He's here. Very welcome to the talk.
Yes, dear Olga, thank you. Dear colleagues, I think it's really fantastic to speak in this historic place, and it's a challenge, of course, to present the relevant structures of the German healthcare system within just 5 to 10 minutes, but I'll try to do my very best. When you look at this slide, you see the major problem our healthcare systems face in past years, which is the steep increase in costs per capita. The United States are doing worse, they have the steepest increase, and Germany is somewhere in the middle. But we have to face these increasing costs against the background of the increase in life expectancy and more costful therapies. Okay, also for those of you who don't understand the German, this is a cartoon which should represent the current state of maybe not only the German healthcare system, but also other healthcare systems in the world. You see a house which looks quite run down, and it's written Gesundheitssystem, which means healthcare system, and down to the left there are signs saying access at your own risk, which may be true for patients who go to emergency departments. And the point is, why do I put this cartoon here? The question is the healthcare system itself a misconstruction or a wrong construction? I believe no, because I think the principle of solidarity on which the German healthcare system is based is well constructed. It was well thought by the fathers who constructed it many years ago. But I believe that there are lots of renovations that due to be done. And I also believe that what we do here with EPMA can really contribute significantly to the renovations we have to face in healthcare systems. And just another cartoon, this is the possibility to overcome budget constraints. You see these people lying in their beds, they are relatively injured, and so the doctor and the nurse suggest to have them get out of their beds and do their morning toilet by themselves. So this is one maybe not too reasonable proposal to reduce costs. Okay, the major points of the German healthcare system are a so-called insurance-based model, based on a social insurance model. And it's an important economic area with more than 4 million employees in 2007. And it's a combination of both public and private health insurance companies. This is just to illustrate the increasing costs from 1995 to 2007 in million euros. There's a steep increase, especially in the public sector. I don't want to refer to this in detail due to time constraints, but I think this slide is quite interesting to understand what is relatively unique to the German healthcare system. And it's the so-called solidarity model. Yeah? That means, based on the German basic law, there's a so-called principle of the welfare state, which implies that the state and the representatives of the state, which also encompasses the German healthcare system, must guarantee all citizens a social justice and the equal participation in society, and this also includes welfare and health. And the principle of solidarity means that not when you are sick, then your husband has to cover the costs and take the burden, but it's the state or it's the entire society. So the strong have to care for the weak and the healthy have to care for the ill. And this system, I think, has been working since the late 19th century. It was invented in the area, in the period of Bismarck, even before the 20th century, and has gone through various modifications during the past 100 years. But as I mentioned initially in my first slide, we have now come to a point where the principle of the system, I think, is still worthwhile being developed and being improved, but we have a problem with this exploding costs. Okay, so the major cornerstones of this healthcare system, of the principle of solidarity means that there is a statutory health insurance in Germany which covers more than 90% of the insurees, and there's an obligation to have health insurance. It's mandatory for all citizens, and 90% are in the statutory health system, and a smaller amount, like 9 to 10%, are in the private health insurance, and only less than 1% they do not have an insurance despite this obligation to do so. And interesting, and a reason for lots of vigorous political discussions is the fact that everybody who earns less than 4,050 euros per month is obliged to be in the public healthcare system, in the statutory health insurance, and whoever earns above 4,050 euros can decide whether to stay in the SHI or whether to switch to a private health insurance. And the problem is that, as you can imagine, those who earn more, who have higher incomes, also tend to be those who are healthier, who live healthier. Okay, so that means that those who earn more, they leave the solidarity model, which is the public health insurance, and they go to the private model at the expenses of the public health model. So there are lots of discussions going on at the moment. I mean, they started a few years ago as to whether to merge these two systems or not, and depending on the political point of view or the party you represent, of course, there are different opinions on that. Okay, it's also interesting that the expenses of the SHI, they are covered by premiums. That means everybody who is a mandatory member of the SHI has to pay a certain amount of his income. This is at the moment roughly 15% of your monthly income, and it's not based on the individual risk, but it's a fixed sum. Yeah, so, and you even don't recognize that you pay. It's just withdrawn from your income and directly paid by the employer or by the state to the social health and to the statutory health insurance companies. And they work more or less independently. Of course, they are supervised by the state. And this is quite a busy slide. I don't want to go into detail due to lack of time, but just imagine you are the insuree at the bottom of the slide. And the thing that's interesting for you, you don't have to take care of the premiums you have to pay. They're directly transferred to the SHI funds. You are given a so-called insurance card, like a credit card, where your data are stored, and you have to present this insurance card whenever you go to the hospital or go to your physician, and the physician will treat you, and he will take care of reimbursement for his work via the SHI. So it's relatively comfortable for the patient. This is another slide which illustrates, and maybe you could pay attention to the bottom part of the slide. The important thing is there is a treatment obligation. That means for every SHI insured patient, the physician who takes part in this SHI system has to treat the patient. So he cannot refuse treatment. Even in those cases, the patient cannot present his card or the assurance status is not clear. Okay, this is another slide to show that the number of insurance funds from the SHI system is continuously decreasing. This is quite a positive development, to my opinion, because this also contributes to the reduction of bureaucracy. The problem is when you have like 900 or 1,000 health insurance companies in Germany for a population of about 80 million, you can imagine every fund needs its president, its board of directors, and all kinds of people working. So this produces enormous costs. So fortunately, this number has been decreasing in the past decades. And the interesting thing is that what the respective funds offer is more or less the same, because it's the state that decides which medical treatment has to be covered by the statutory health insurance. So there's really no difference between these various funds. Okay, just some more numbers. This shows the numbers of physicians